Well, the first one that I have, doctor, is what is postmenopausal osteoporosis and who is most at risk?
Well, osteoporosis is characterized by low bone mineral density and decrease in bone strength, which may lead to fragility fractures. So fragility fractures are broken bones that occur from a simple trip and fall, maybe falling on an outstretched wrist, and we call those fragility fractures. And postmenopausal women are at increased risk for this type of fracture because at the time of menopause, they lose the protective effect of estrogen that we have on our bones, and so we're at more risk for these type of fractures. So women in general and some healthcare providers dismiss the serious nature of these fractures. They think it's an isolated event, a broken bone from a clumsy fall. And in fact, it could be the signal that we need to evaluate for underlying osteoporosis.
So I think you've sort of begun to touch on my next question, which is great, and that is, it appears to me what you're saying is that the women themselves and certainly their physicians are not making that connection. They're not seemingly making the connection between the fractures and osteoporosis.
That's right. Unfortunately, that connection between the fractures and underlying osteoporosis is often unrecognized. And it's a shame because it affects so many women. In fact, 1 out of 2 women after the age of 50 will experience a fragility fracture in their lifetime. 1 out of 2. And it's serious. We know that there are more hospital admissions for osteoporosis fractures than a combination of heart attack, breast cancer, and stroke. And those are scary health topics to women, and yet we don't really recognize the serious nature of the fractures. So you are correct, and that's why I'm here today. It's because I want to team up with Radius Health to increase awareness about osteoporosis and the related fractures.
Wow, that statistic just jumps right off the page. In connection with that, what are some of the risk factors? Obviously, some people, some women in this case, are a little more vulnerable to osteoporosis and, of course, the problems that are associated with it. So what are some of the risk factors that people should be looking for?
Well, unfortunately, if we live long enough, aging is a risk factor. Being postmenopausal is a risk factor. But one of the most important and urgent factors is that first fracture. So we want to pay attention if we have back pain and a broken bone in our back or a wrist fracture or a hip fracture, we need to get that evaluated.
That makes perfect sense. So obviously the logical follow-up question is, because people are going to suffer from postmenopausal osteoporosis, what are some of the treatment options that are currently available when somebody gets the diagnosis?
Right, so when you go to your healthcare provider, you want a comprehensive approach. We want to focus on exercise, calcium and vitamin D rich foods, and strengthening exercises and balance exercises to prevent that fall and that fracture. But if you do need a medication, there are 2 general classes. One is an anti-resorptive, which decreases bone resorption or bone loss to maintain the bone. The other is an anabolic medication, which increases bone formation by naturally stimulating our body's bone-building cells. Now, Tymlos is a medication indicated for the treatment of osteoporosis, and it's an anabolic that decreases the risk of future fracture. Now, with any medication, there may be side effects. So lower blood pressure, dizziness, maybe increased calcium in the urine and in the blood may occur. And in laboratory animal testing, some rats did develop a bone cancer, although this has not been shown in humans. But to decrease that possible risk, we recommend that anabolic agents of any type not be given for more than 2 years. But medications are just part of a comprehensive approach to decreasing fall risk and decreasing fractures.
Well, Dr. Oates, you've given us quite a bit of a snapshot about the issue and the treatments. This may spurn people to want to seek help or more information. So if they do want more information on the treatments and, of course, the disease, where do they go? Where can they go for more information?
First stop should always be your healthcare provider that knows your health issues best, but we have some really good information on our website, bonenews.com. It has great information about postmenopausal osteoporosis and fracture risk.
Excellent. Dr. Oates, you've been a fount of knowledge. Thank you so much for your time, and have a great day.